We're here at a London medical school to find out what the future generation of health professionals think of the proposed reforms. This school has been training medical students since 1733 and today teaches biomedical science, radiology and clinical practice amongst its other specialisms. With the BMA meeting that happened on the 15th of March and that actually made the decision regarding the proposed reforms, do you know if any medical students were engaged?
I know there were students there. Don't know how much involvement they actually had, whether they were just there to listen or whether they actually got to talk. But essentially they are trying to get as many students involved in the reform and just understanding what's going on, because it is going to affect our future and how we will work within the NHS, so it is important for us to know as early as we can, really.
How have you kind of kept up to date with the NHS reforms? Has it been through the school or has it been kind of off your own back?
It's a bit of both, really.
Yeah.
There's always someone to talk to in our university if you need to find out a bit about kind of what's happening in the higher up stages, but I think most of the time it's just been kind of internet and BBC News.
Yeah. It's a lot of media stuff, so I mean it's been talked about a lot for quite a while, especially with the new government and everything, so sort of a lot more media based rather than, we don't get any like formal information from the uni, but there are staff members that you could talk to about it as well.
When you do placements, a lot of your placements are hospital based. Do you think maybe it'll be an idea to kind of get you guys involved in general practice and placements, even if you're not thinking about the specialism earlier on as well, just to give you a kind of better, broader overview of what's going on?
You're probably best answering.
Yeah, we do have, from our third year, you do get a placement within GP, which is a lot more patient contact than the managerial side, but it does kind of give you an idea of how a GP is run. It could be arguably with the new changes that it might be necessary to do a longer placement on GP or actually have formal teaching with the GP on those changes, so that could be quite useful in the future.
So what in general are your kind of opinions of the proposed changes then?
As a medical student, I'm a little bit worried because I understand that some of the like the GPs could say, okay, everyone who's got a hip fracture, that will all be done privately, which means that as a medical student, those are kind of procedures that we wouldn't be able to see in our training. It's also a slight worry that if things do get more privatised through the reforms, we won't get as much funding for our training. So those are kind of my worries about the reform, and I don't really see the need for it. That might just be me being naive, but at the moment I can't understand why it's happening.
I think the other issue is it's essentially, with the government giving all the money to GPs, they're essentially, to an extent, like removing themselves from responsibility on the healthcare. And it could be, although we are thinking, okay, it could save money, it's more efficient and patients will get better care, if something were to go wrong within certain GP consortiums, then there's no backup from the government to sort it out, and therefore that whole area could then have problems in their healthcare for further on. And it could just end up with certain areas in the country having great healthcare services and other areas not having a good overall system. So it could be damaging in the long run.
I think it's also important to think about the incorporation of the hospital doctors and public health professionals and doctors. That's a really key element that it kind of seems like the power's being taken away from them. And GPs do have a very vital role and they do need more power, but if it's exclusively to them, it's a bit worrying.
So does this proposed change, because obviously this is the future of the NHS we're talking about and obviously the future of possibly your medical career, so does it affect maybe your choice of specialism or maybe even the idea of working for the NHS in the future for you?
I definitely would work for the NHS in the future, there's no question about that, but I want to be a doctor, I don't want to be a manager, so if there was any chance of me going into being a GP and having to manage all the budget and everything the whole time, I wouldn't do it because that's not what our 5-year course is training us for.
Yeah, I totally agree with that. It's like you do want to be an actual doctor rather than secretarial paperwork, dog's body. So it could affect that. But also, I guess it could affect where you decide to work in the future. Because like with certain trusts, there'll be bigger areas. You may only get to do certain procedures in certain trusts in certain areas of the country. You may decide, I'm going to go live there just so I can do what I want, the speciality I want to do. So it could mean that we're all not in the right place, just we're in the place where it's best for the trust.